starts to look a little weak. And then you're open to the charge that foreign leaders have figured out you don't want to do much, and they're exploiting that window of opportunity, which is, of course, the charge being made about why Putin got so aggressive on the Crimea.
In a bid to show strength, Mr. Obama said the U.S. will not seek permission to defend itself and will continue anti-terrorism drone strikes while trying to avoid civilian casualties. The president also announced plans to spend billions to help nations in Africa, Asia, and the Middle East fight terrorists, and pledged to boost support for Syrian opposition groups. Foreign assistance, diplomacy, and development, Mr. Obama says, are part of what makes America strong. Luis Ramirez, VOA News, at the White House.
We want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa54, and check out our headlines 24/7 on voaafrica.com. Coming up, the deadly Ebola virus claims another victim. We'll have an update in our health report next.
Like Voice of America on Facebook. Follow VOA on Twitter. Join VOA on our YouTube channel. Like, follow, join VOA.
Welcome back. Joining us now is Africa 54 health correspondent Lino Medu. What do you have for us today, Lino?
Hello, Vincent. The World Health Organization says there are 7 confirmed cases and 9 suspected cases of Ebola in Sierra Leone. This comes after suspected Ebola patients were taken out of hospitals by their families, defying doctors. One of the patients has died. Sierra Leone reported its first confirmed outbreak of Ebola earlier this week. WHO says Guinea's capital Conakry has recorded its first new Ebola cases in more than a month, while other previously unaffected areas have also reported infections in the past. Dr. Pierre Formonti is an expert with the World Health Organization. He says support is needed from the population to help contain the outbreak.
The people are in place, the authority understand the gravity of the situation. I think that we all understand that. Not only the authorities, but all the partners working in Sierra Leone, in Liberia and Guinea. We all want to control this outbreak, and we will control this outbreak. And it will take probably longer than expected, but we cannot do it against the population. We should do it with the population, and if there is things that the population do not understand, we must listen and try to make them understand why they need to change some behavior vis-à-vis other behavior. It's our role and our duty.
And nearly 200 people have died of Ebola in West Africa since the outbreak was first reported in Guinea in March. A new study conducted by Doctors Without Borders and the Guinean Ministry of Health shows that an oral cholera vaccine proved to be effective in controlling the disease during a recent outbreak. Public health authorities in Guinea administered the vaccine, called Essential, to children in 2 rounds over a 6-week period in 2012. The vaccine dramatically reduced disease transmission by 86%. The researchers say their findings support using the vaccine to contain future cholera outbreaks. The results of the study are published in the New England Journal of Medicine. And joining us is Laura Schemp, Senior Immunization Technical Expert with John Snow, Inc., a public health management consulting and research organization dedicated to improving the health of individuals and communities throughout the world. Ms. Schemp, welcome to the show.
Thank you.
First of all, what do you make of this new finding, a possible new cholera vaccine? How is this an added value to what we already have?
It's very encouraging because, I don't know, your listeners are probably aware, the Global Alliance for Vaccines and Immunization has been internationally supporting development of new vaccines and to try and reach vaccination beyond just the normal child vaccination, but actually to be able to help adult populations with some of these neglected tropical diseases as well as, beyond just the normal child illnesses. So it's very encouraging that, particularly for outbreak control, because cholera, as we know, can be very infectious.
Absolutely. Now, you've been working on the ground in Africa and many other countries, many other continents, and some countries in Africa, let me precise this. So with your experience on the ground, we still see that there are children who are dying from vaccine-preventable diseases. What do you think that is lacking? Where is the issue here?
A lot of it, there's commitment, I think, international commitment, Ministry of Health commitment in countries. In a lot of cases, it's the funding to ensure prevention and to get countries to help support preventive health. But then also, immunization is a routine service. So every year we have children born. Every year new people and children need to be vaccinated. And a lot of the challenge is having the recurring operational costs to get those services to that, what we call the last mile, getting it out to those children in very rural communities or in dense urban areas who need the vaccines the most.
Remote areas where it's very difficult to access.
Exactly. Logistically, the end of the road or the end of the lake or the middle of the lake, the island.
Yes.
But then also in dense urban areas, the communities that may not want to be so visible. Immigrant communities or populations that have been marginalized.
So can you share an example of best practice in a country or a community that has succeeded in perhaps a program that was really making a difference?
Yeah, in several countries we've seen, particularly with the new vaccines coming in, we're seeing huge reductions. I mean, measles is one that everybody knows. You bring measles vaccine into a community and you see the measles incidence and cases go immediately down. But with some of the newer vaccines, for example, a few years ago when I was in Madagascar, I had talked to a doctor out in a rural community, and he had been seeing a lot of cases of Haemophilus influenza B, a type of respiratory disease. And he noted that in the 2 years since they had introduced the vaccine, that he no longer saw cases in his community. And he said, my treatment didn't change, it's the vaccine that helped. And that was really a positive result.
Thank you so much, Laura Shemp. We have to leave it there.
Thank you very much.
And that was Laura Shemp, Senior Immunization Technical Expert with John Snow, joining us here in the studio. And that's your Africa 54 Health Report for you today. Back to you, Vincent.
Wow, thank you very much, Lenore Madu, for joining us today. Be sure to watch for Lenore Madu's every Tuesday and Thursday for the latest health news in Africa right here on Africa 54. Now, yesterday on Africa 54, we introduced you to Consolé Nishimwe, a survivor of the Rwandan genocide. Nishimwe's father and 3 little brothers were brutally murdered. The killers spared her life, but only after raping and infecting her with the HIV virus. In part 2 of my interview with her, Consolé shares her story of survival, endurance, and hope.
The first day I remember in the night when we went to the bushes and hiding, and when we came out, my paternal aunt happened to be with us, so she was killed immediately. So, but I didn't watch it with my own eyes, but my siblings saw what happened. So, and the rest of us managed to keep hiding in many other places, and that same day I remember when we managed to go to hide in another place, and when the killers, of course, followed my dad, and while we were sitting in our house, and that's when I remember I heard them saying that they have murdered him. Another place I remember we went, unfortunately, these killers, found us where we're hiding, and that's when my brothers were killed. They decided to kill my brothers, yeah. There were 3 younger brothers from age 9, 7, and almost 18 months old, yeah. And it was very tough for my mom and all of us to manage. We begged them to be killed because there was no other choice for us to just ask them, at the time even begging them to kill all of us together. But my brothers were killed in our burn house, and someone who killed them was someone who grew up with my mom. We managed to keep hiding again and going to some other place, even though we didn't want to do that. And as you know, that in the country, many women and girls were raped before even they're being killed, so tortured in many ways. And unfortunately, the place we went to hide, one of the killer came there with someone actually who was, with